Vitamin D, also known as ergocalciferol D2, cholecalciferol D3, or alfacalcidol, is a fat-soluble vitamin that helps the body absorb calcium and phosphorus. This is important for building and maintaining strong bones. Vitamin D is used to treat and prevent bone disorders such as rickets and osteomalacia. It is made by the body when the skin is exposed to sunlight, but factors like sunscreen, limited sun exposure, and dark skin may prevent getting enough vitamin D from the sun. Vitamin D with calcium is used to treat or prevent bone loss, also known as osteoporosis. It is also used with other medications to treat low levels of calcium or phosphate caused by certain disorders like hypoparathyroidism, pseudohypoparathyroidism, and familial hypophosphatemia. In kidney disease, it helps keep calcium levels normal and supports normal bone growth. Additionally, breastfed infants are given vitamin D drops or other supplements because breast milk usually has low levels of vitamin D. It is recommended for kids to take vitamin D3 supplements daily to ensure they are getting enough of this essential vitamin. The best time to take kids vitamin D3 is in the morning with a meal. The daily dosage for kids varies based on age, so it's important to check with a healthcare provider for the correct amount for your child. When taking kids vitamin D3, it is best to take it after a meal, but you can also take it with or without food. The dosage will depend on your medical condition, sun exposure, diet, age, and response to treatment. If you are using the liquid form, be sure to measure the dose carefully with a special measuring device. If you are taking the chewable tablet or wafers, make sure to chew them thoroughly before swallowing. For rapidly dissolving tablets, place each dose on your tongue and allow it to dissolve completely before swallowing. Certain medications can decrease the absorption of vitamin D, so it's important to take them at least 2 hours apart from kids' vitamin D3, or as advised by your doctor or pharmacist. Taking this medication regularly at the same time each day will help you get the most benefit from it. If your doctor has recommended a special diet, it's important to follow it to get the most benefit from the medication and prevent serious side effects. And always remember, do not take other supplements or vitamins unless ordered by your doctor. If you think you may have a serious medical problem, be sure to seek medical help right away. It's important to note that at normal doses, vitamin D3 usually has no side effects. However, if you experience any unusual effects, it's important to contact your doctor or pharmacist promptly. If your doctor has recommended this medication for your child, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience any serious side effects. It's important to be aware that consuming too much vitamin D can lead to harmful high levels of calcium. If your child experiences any of the following symptoms, it's crucial to contact your doctor immediately: nausea/vomiting, constipation, loss of appetite, increased thirst, increased urination, changes in mental or mood, or unusual tiredness. While it's rare, a very serious allergic reaction to this medication can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. Keep in mind that this is not a complete list of possible side effects. If your child experiences any other effects not mentioned, it's important to contact your doctor or pharmacist. As always, if you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or on their website. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. If you or your child are allergic to vitamin D or other vitamin D products, or have any other allergies, it's important to talk to your doctor or pharmacist before using kids' vitamin D3. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to discuss this with your pharmacist. Before using this medication, it's important to discuss your medical history with your doctor or pharmacist, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, kidney disease, or liver disease. It's also important to note that liquid products, chewable tablets, or dissolving tablets may contain sugar and/or aspartame, and liquid products may also contain alcohol. If you have diabetes, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit/avoid these substances in your diet, it's important to ask your doctor or pharmacist about using this product safely. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, it's important to discuss the use of kids' vitamin D3 with your doctor, as doses greater than the recommended dietary allowance should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before using this medication, as it can pass into breast milk. It's important to be aware of any potential interactions with other medications when taking kids' vitamin D3. Some products that may interact with this drug include burosumab and phosphate binders. Make sure to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium, magnesium, phosphate, or vitamin D. It's also crucial to avoid using medications containing calcitriol while using vitamin D. Additionally, this vitamin may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are taking kids' vitamin D3. If your child accidentally takes too much kids' vitamin D3 and experiences severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include seizures, confusion, and an irregular heartbeat. When giving your kids vitamin D3, it's important to keep in mind that certain lab and medical tests may need to be done, such as checking their levels of calcium, magnesium, and phosphorus. It's also a good idea to make sure to keep up with all medical and lab appointments. In addition to taking the supplement, you can also incorporate foods rich in vitamin D into your child's diet. Some examples of these foods include fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. This can help ensure that your child is getting enough vitamin D in their diet. Remember to consult your doctor for more details and guidance on the best approach for your child's specific needs. If your child misses a dose of kids' vitamin D3, make sure they take it as soon as they remember. However, if it's close to the time for their next dose, it's better to skip the missed one. In that case, they should just take the next dose at the regular time. It's important not to double the dose to catch up. When it comes to storing vitamin D products, it's important to keep them at room temperature away from light and moisture. Avoid storing them in the bathroom, and if you have alfacalcidol drops, they should be kept in the refrigerator but not frozen. It's crucial to keep all medications out of reach of children and pets. When it comes to getting rid of expired or unneeded vitamin D products, it's important to not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.